Acute myeloid leukemia, brought to you by Medicine Isn't Scary. Don't forget to subscribe. Hey everyone, and welcome back to the channel. Today, we're talking about a cancer that moves fast and hits hard. Acute myeloid leukemia, or AML. It is the most common acute leukemia in adults, and understanding it is key to seeing how our bodies can sometimes break down in a dramatic way. Well, the word acute can sound scary, and honestly, this is a serious disease. But by the end of this video, you'll understand what exactly is happening inside the body, what it causes such specific symptoms, and how modern medicine fights back. We're going to use a simple metaphor throughout, the bone marrow factory. Let's get started. First, let's break down the name. Acute means that it's developing rapidly over weeks. Myeloid means that it's the type of cell that it affects, which is the myeloid stem cells. These are the master cells that were supposed to become your red blood cell, your platelet, and most of your infection-fighting white blood cell. And for our metaphor, you can imagine your bone marrow is an incredibly sophisticated factory. Its job is to produce trillions of healthy, fully functioning blood cells every single day. It has assembly lines for red blood cell, platelet, white blood cell, and neutrophils. So, the red blood cell is in charge for carrying the oxygen. The platelets were the tiny plugs that stops the bleeding. And neutrophils are the infection-fighting soldiers. In a healthy body, this factory is a model of efficiency. However, in AML, some things go terribly wrong. AML starts with a genetic mutation, a random spelling error in the DNA of just one single myeloid cell. This glitch does two things. It makes the cell immortal and it refuses to die, and it makes it to reproduce uncontrollably. And this is what we call as the blast. This one faculty cell started churning out a copy of itself, and these are faulty. These copy blasts were immature, useless cell that could never grow up and to do its job. And basically, this is the factory fire. This blast multiply like wildfire, completely overwhelming the entire bone marrow, affecting your entire blood factory. They crowd out the healthy cell, the production of red blood cell, platelet, and the function of white blood cell greens to a halt. This factory is not only producing dangerous and flammable garbage. Therefore, it's very important for us to know what are the tests that we can do. So, to know what are the tests that we need to do, we can split it in two main parts. One is how to confirm the fire, which is how to confirm whether the patient is having the AML. And second, to know what kind of fire we're fighting. So let's go on to understand about the test that allows us to confirm the fire. The first clue often comes from a simple blood test called the complete blood count, or what we know as the CBC. It is like checking the factory's output. In AML, the CBC results shows a terrifying picture. Firstly, because the blast was overcrowding the healthy cell, so you can imagine that the red blood cells number has been decreasing, which could lead to signs of anemia. The platelet line is also down, leading to thrombocytopenia. Therefore, the patient with AML often reports to have bruises all over their body, petechiae, or even bleed easily. And crucially, it shows blast. These are the immature, useless cells where they would never be. They would slowly move from your bone marrow into the bloodstream. Therefore, you can actually confirm the AML with the test of the peripheral blood. Inside the peripheral blood, you're able to find some aura rod. These are the needle-like structures inside the blast that are basically the smoke gun of the AML. Seeing blast inside the blood cell is actually already a very strong evidence. And then we need to go into the factory itself to confirm what happened. And to confirm what actually happens inside the factory, we need to go inside to do a bone marrow aspiration and biopsy. In this stage, the doctor will use a special needle to take a small sample from the hip bone. This is the definitive test. So therefore, it's known as one of the golden methods for it, okay? A healthy bone marrow is like a diverse ecosystem with cells at all stages of development. However, in AML, it is a disaster zone packed with wall-to-wall with identical blast. This diagnosis is official when the blast makes up to 20% or more of the bone marrow. The factory isn't just on fire, it's completely being taken over. Now, confirming that AML isn't the end of the story. It's just the beginning. Because not all AML are the same. And we need to investigate what exactly are the type of fire that we're dealing with. Therefore, we can choose the right firefighters and equipment. This is done with 3 powerful tests on bone marrow sample. Firstly, the flow cytometry, which is also known as the immunotyping. This test identifies the specific protein ID cards on the surface of the blast cell. It confirms that the cells are definitely myeloid, and it's not like a different leukemia like the ALL, and it can identify specific subtypes. Remember, for a human, we have ID cards. However, for the biomarkers and blood cancer, we have the CD card, okay? And secondly, it is what we know as the cytogenetics. This looks at the chromosome, the factory's blueprint for large-scale error. Are there big structural problems, like 2 chromosomes have swapped pieces? These findings are crucial for determining if the AML is favorable, intermediate, or high risk. Thirdly, is the molecular study. This is the most detailed level. It looks for tiny spelling errors inside specific genes, like the FLT3, NPM1, and also the IDH1. These are absolutely crucial because these mutations are targets for smart bombs, which is known as the target therapies. These is no longer a one-size-fits-all. So for the molecular study, it actually helps us to guide our target therapy. So we'll be diving into the different types of target therapies in the later videos. Last but not least, the patient will also do the lumbar puncture. When will the lumbar puncture be done? When the doctor suspects that there is an CNS involvement. So the CSF will be taken out from the lumbar area so that we would see if the central nervous system is being involved. Okay? So before launching the attack, which we know as the chemotherapy, the doctor needs to make sure that the patient's body, the battlefield, is ready. This involves a suite of tests to assess the overall health and intermediate risk. First of all, we need to ensure that the patient's heart condition is okay. Therefore, we need a cardiac echo or an ECG. This is because for many of the chemotherapy, there were actually cardiotoxicity. For example, daunorubicin. Secondly, we need to make sure that we have done the liver renal function test and we have a comprehensive metabolic panel. This is to ensure that the kidney and the liver function for the drug dosing. So, if the patient has a poor renal function, then sometimes the chemotherapy will be reduced into the renal dose. Okay, so we need to make sure that we are doing the liver renal function test before we are giving the chemotherapy. Okay, so the third one is for infection screening. For viruses that, for example, hepatitis, which could reactivate during the treatment. You need to remember, during chemotherapy, the patient is actually very fragile and very neutropenic, okay? Therefore, there is a high chance that the patient may have different types of infections. So therefore, the doctor will usually do some regular checkups, okay? So there are also some prophylactic medication that we give to the patient. For example, we may give acyclovir to the patient to prevent zoster, or maybe we'll give entecavir for the patient to prevent hepatitis B, okay? So this what comes over with the infection screening. Number 4, this is the coagulation panel. This is to check for the bleeding disorder, which is a risk in some AML subtype. So for this part, it is actually referring to a subtype in AML, which is called as the APL. Okay, so we're worried that the patient may have APL problem, okay? In which in the APL, patient will usually have a complication, what we call as the DIC, disseminated intravascular coagulation. So for these concepts, we'll be having another video to talk about what is APL and what is DIC, okay? So we wouldn't dive too much in this video. So if you're interested in it, please make sure you follow my next video, okay? So this entire diagnostic journey, from the first suspicious CBC to the full genetic profile, takes about a week. But it gives the oncology team a complete map of enemy and deterrent. Armed with all these information, the team create a personalized battle plan. Remember, the goal for this battle plan is remission. We want to put the fire out so that the factory can be rebuilt. For most, this starts with the intensive 7+3 chemotherapy, in which the 2 medication here we're actually referring to cytarabine and also daunorubicin. So these are the powerful firehouse to flood the factory. For those with specific mutation, like the FLT3, we'll add a target therapy, which is a precise bomb from day 1. This treatment is brutal but necessary. It helps to wipe out the blast, but also destroy any remaining healthy cell, leaving the patient with no immune system for weeks. They need to be in hospital, protected, and supported with transfusion until the factory fully recover. So, the journey from symptoms to an AML diagnosis is rapid. The intense progress of gathering evidence. It starts with a simple blood test, moves to a bone marrow biopsy for confirmation, and culminates in a deep genetic investigation that guides a personalized, life-saving treatment plan. If this detailed walkthrough helped you understand the science and medicine behind AML, please give this video a thumbs up and subscribe for more deep dives. I'd like to hear from you. What other medical diagnosis process would you like me to explain? So please let me know in the comments below. In the future videos, we'll also dive into the subtype of AML, the APL, and also the complication of DIC, disseminated intravascular coagulation, as well as what other things they need to pay attention when you're giving different types of chemotherapy for your patients. So, till next time, curious mind, I'll see you in my next video. Bye-bye! Remember to subscribe my channel before you leave. See you soon!